Hi everyone, today I shall discuss about the sclerous tissue which forms the skeletal framework of our body. Now you know the sclerous tissue, it is a specialized connective tissue. Here the matrix is solidified and there are two types of sclerous tissue, one is cartilage, another is the bone. Now cartilage, you will see there are three types of cartilage. One is hyaline cartilage that covers actually this articular area, and when we are in the intrauterine life, this is the skull of a newborn baby. Here you will see all the framework of the bone is formed by the hyaline cartilage. Next, the cartilage, that is the elastic cartilage. The pinna of our ear, it never ossifies, at least up to the depth. So this is the elastic cartilage. And there is fibrocartilage, that is the example of intervertebral discs between the two vertebrae. Next, the bones. What is the difference between the bones and the cartilage? You will see in the bone, it is more, matrix is more solidified, and there is presence of a compact bone outside which is solid and spongy bone inside. You will see here there are laminae of the spongy bones. So you will see where the compactness is required, as well as you will see the framework is rigid, their bone is interposed. But where the cartilage is there, that means in front of the chest there are costal cartilage, the pinna, that is the another cartilage, the cartilage of the voice box, all this cartilage where not only firmness but also certain degree of resilience is there. So this is the difference between cartilage and the bone. And you will see the bones, you will look here, you look that there is no vascularity. But human bone within the body, it is more vascular, it is not so white, it is a bit pinkish due to the halo of the arteries. And this bone is also covered by a membrane, and the name of the membrane is periosteum. And you will astonish to know all the muscles of our body is attached to the periosteum. Now, what are the types of bone according to the shape? According to the shape, you will see this is the long bone, that is the length is greater than the breadth, and here that this is the typical long bone or long bone where you will get two epiphyses or two end and the intervening shaft or diaphysis. Now another type of long bone is there, that is the short long bone, which you will see the skeleton of hand and the skeleton of the foot, and this long bone is known as the short long bone or miniature long bone. So you will see that metatarsal and the metacarpal are the example of the miniature long bone. Next, another long bone you will see here, that this long bone is known as clavicle or the collar bone. This is horizontally placed, and you will see this bone has got two ends and the shaft, and it is pierced by the supraclavicular nerve. This is known as modified long bone because it has got no medullary cavity like the other long bone. So this is the example of the different types of long bone. Next, the short bone. You will see here the hand, this bone, small cubical bones, but it is not like geometric cube. It has got 6 surfaces, but the surfaces are modified. This tarsal bone, these are the example of the short bone. Now this short bone, why our higher power, that means the Almighty, is always reasonable. Thou place these bones in such a way so that we can do the fine movement, and strength is also there, because you see in this short bone you can flex your hand and you can make it a narrow thing so that a bangle can pass through it. You see, this is the bangle, how I can pass it throughout this. So this is the reason of the short bone. And there are 8 short bones in the hand, and there are 7 short bones in the foot, out of which the largest short bone is the calcaneum, which forms the heel, from which the weight of our body is transmitted to the ground. So these are the example of the short bone. Next, another bone is the flat bone. You see, the shape is flat. This is known as the sternum or the breastbone, which is situated in front of our breast. So it has got outer compact layer, thin, inner compact layer, and in between there is diplo or this type of tissue. So the thin to compact bone and the diplo inside, this is the flat bone. The example of flat bone, also parietal bone in the skull. You see, this is the skeleton actually of a baby that is about 1 year old, because you see here the soft fontanelle that is actually ossified at the age of 1.5 years of age. So this is the example of the flat bone. Next bone you will see, this is the hip bone. It is irregular in shape. It does not fit with the long, short, flat or anything. So some portion is flat, some portion is different types. So it is known as the hip bone or irregular bone. And the vertebrae, which forms the vertebral column behind the back, this bone, backbone, it is also example of the irregular bone. So after the irregular bone, I shall discuss about another type of bone, that is, you see, it is very light bone, and there is a gap, cavity or air inside. Air means air is called pneuma. So this bone is known as the pneumatic bone. And you will see here the socket of the teeth. You will see some teeth are there also. So this pneumatic bone present in the face, and this forms the upper jaw. The last but not the least, that is the another type of bone that is situated in front of the knee joint, and this bone is known as the patella. And this patella, in the Bengali it is known as the Malai Chaki, and Hindi it is known as the Ghutna. So this patella, that is no example of the sesamoid bone. It develops after birth of the baby, and there is no Haversian system like this. If you see under the microscope, there is a deposition is like a cylindrical, but here there is no such type of deposition. So this is known as sesamoid or sesame-like bone, seed-like bone, that is known as the patella, as well as this is known as the pisiform bone. This is the pisiform bone. So this is the example of the sesamoid bone. Another type of bone is present occasionally in somebody, that is the extra bone. This extra bone that may lies in the cervical region or neck region or lumbar region or in the skull, and these bones are known as the accessory bone. So this finishes the bone and the classification of the bone. Thank you everybody. So thank you everybody, and I think the beginner will be benefited with this video.